One of the best ways to start off your treatment is to start with a general scan. A general scan tells you where the spine is most stiff. Notice I put my arm across her shoulders, and then I use a very gentle, soft fist to have the patient arch their back and relax, just like we did when the patient was on their side, and I look for the stiffest area. And this gives me a general idea of where I might want to start when the patient is on their side. I can also do this in the cervical spine by using two fingers, any two fingers, and gently press to feel where there is stiffness. In the next lesson, lesson 3, you're going to learn how to mobilize this upper thoracic area. Until then, I want to show you how to palpate it. So what I'm going to do to perform this general scan in the upper thoracic area is I'm going to put my thumb just lateral to the spinous process. And I bend to one side and look to see what is the tightest vertebra. And then, of course, I palpate the other side to see which side is stiffest, whether it's left or right side bending, to prepare me for lesson 3, where we learn how to mobilize that region. Another very general scan that you can do is to check both shoulders. You very gently put your hand on top of the AC joint, which is, of course, part of the acromion process of the scapula and the end of the clavicle, and you elevate the arm. And if the patient is stuck, that's a positive test. If a patient is mobile, then the arm goes up close to the head. If you want to focus a little bit more on the lower back and pelvis, you can take your hand and palpate the lower lumbar spine and even go right over both sacroiliac joints, and you'll generally find it will feel a little tighter on the left and a little softer on the right. And we're going to go into this in a later lesson, but that is very, very typical.